More on those rules now. Eisenhower Health says they're looking at that new state guidance. The rules say that through February 1st, healthcare workers who have tested positive without symptoms can return to work right away without needing to quarantine. They are required to wear an N95 mask. The guidance also says hospitals implementing the rule change must have made every attempt to get other contracted staff. I spoke today with the Chief Medical Officer at Eisenhower Health, Dr. Alan Williamson, on whether Eisenhower may need to implement those new guidelines at any point and how the hospital is holding up in general.
How is Eisenhower Hospital doing right now in terms of dealing with this surge in COVID?
And so we're seeing definitely an increased number of cases. We're up to about 57 or 58 cases in the hospital today. About a half a dozen of those are in the intensive care unit. So definitely a continued rise in the number of cases coming into the hospital. We're holding our own in terms of facilities. We have enough supplies. We're doing okay in terms of staffing, although that's really a day-to-day. Our biggest challenge is being sure that we have adequate staff in order to care for these patients.
I know of one case, not your hospital, this was in LA County, where someone contracted COVID in the hospital after they had been there for 10 days. And so now with new guidance coming out from the state, how are you going to handle that? Are you going to use personnel who have COVID?
Yeah, at this point, the CDPH has basically put out guidelines to address the fact that this, which is a little bit different than previous, we're seeing more impact staffing time in addition to the increased number of cases that are coming in. The Omicron variant seems to be so infectious that even though our staff are fully vaccinated and in many cases also boosted, they're still falling ill with COVID-19. Most of them very mild, but we are still required to keep them quarantined at home and not working, and that's impacting our ability to staff the hospital adequately. So the CDPH guidelines are geared towards what happens if we reach a crisis in terms of staffing. So I think everyone needs to understand they're not necessarily proposing that all hospitals do this immediately. They're just saying that if we get into a situation of a crisis where we're really unable to maintain full staffing ratios and care for the patients the way we would like to and need to, that we can start to use infected individuals, ideally trying to pair those up and caring for other COVID positive patients as well as much as possible. And at this point, we're not into that kind of a crisis mode. We are preparing for how we can try to mitigate the situation so that we don't ever get into a point where we are in a crisis for staffing.
So just to be clear, what is the policy right now? Someone with COVID, do they have to retest before they return? Is it 5 days, 10 days, so forth?
Yeah, at this point, what we are doing is following the CDC current guidelines, which now allow for individuals who've been exposed but are fully vaccinated. They can continue to work as long as they remain asymptomatic. All of us are wearing masks and all the other full protective gear all the time anyway. Even patients, even employees, I should say, that are infected with COVID, as long as their symptoms are mild and are resolving or resolved completely, they feel well enough to do so, they can return to work after 5 days with a N95 mask for an additional 5 days.
How about emergency room wait times? We've heard some complaints about that. Is it worse than it normally would be? This is normally flu season, and so it's a high stress time of the year.
Yeah, it is worse than normal. And because a lot of the patients that we're seeing in the emergency room are folks who are coming in with relatively mild symptoms suggestive of an upper respiratory tract infection, possibly a cold, possibly flu, possibly COVID. But because everyone's so concerned about COVID, the individuals are coming in really wanting to be tested for COVID-19. That's their primary reason to present to the emergency department. And that takes time. With patients that were coming in with a flu and so on, we were able to turn those patients around fairly rapidly in and out of the emergency room, send them home with instructions on how to care for themselves at home. But these folks that are coming in that really want to be tested for COVID-19, that takes some time. We have to sequester them away from the rest of the population. We have to get the test done on. And so that's unfortunately backing up our wait times into the lobby.
Doctor, thank you much.
Thank you, John.